Hello, everyone, and welcome to the presentation all about neural therapy. So, first, you might be wondering, am I in the right place? Why am I here? Do you have brain fog, fatigue, memory issues? Maybe you're struggling with headaches, migraines, joint pain, maybe a lot of sinus congestion, allergies or asthma, swollen lymph nodes, or any scar tissue on your body. If you have any of these things, I want to talk to you about how neural therapy can help you. So, my name is Kat Bodden. I am a naturopathic doctor and the owner of Sea Change Medicine here in Portland, Oregon. And, truthfully, the reason why I have a physical office is so I can do neurotherapy with my clients. So, let's talk about what neurotherapy is. It was developed in the 1920s by two German brothers, Ferdinand and Walter Hunke, I believe is how you pronounce their last name. It's relatively unheard of in North America, but it's a treatment that's widely used in Europe. It's actually taught in a lot of German medical schools and actually used by about 35% of all German MDs. It's also popular in South America, and neurotherapy is used to treat a pretty wide variety of health conditions. So why isn't it popular here in the US? I honestly think it's because neurotherapy is cheap and it works. And, our current healthcare system doesn't really love things that are cheap and effective, especially with the healthcare crisis that's been going on recently. So these are just some of the things that I use neurotherapy for in my practice, weekly. Like I said before, brain fog, fatigue, migraines, headaches, anxiety, any kind of scar tissue, especially scars in the abdomen, but really scars anywhere on the body. Allergies and asthma, sinus congestion, joint pain, acne, lymphatic stagnation, GI conditions like constipation, diarrhea, SIBO, any kind of dental issues, and also for detox. These are for things like mold illness, heavy metal toxicity, tick-borne infections, other types of chronic infections, and environmental toxicities. So, neurotherapy works by addressing things called interference fields. Interference fields this is a newly recognized barrier to healing that really interferes or blocks with normal functioning of other parts of the body. And so these interference fields are generated by things like scars, injuries, dental procedures. And it's kind of hypothesized that this phenomenon is regulated by our autonomic nervous system. So this is the part of our nervous system that controls unconscious things like heart rate, how much we breathe, our circulation, sweating, etc. Things we're not like actively thinking about. So somehow these autonomic nerves are actually unable to effectively communicate across these interference fields. And so how do we identify interference fields? They're actually characterized by having what's called an abnormal resting cell membrane potential. And if you may remember from high school bio, maybe you don't, so let me explain it to you. The resting cell membrane potential is actually this electrical difference inside the cell compared to outside the cell. So in healthy cells, this potential is negative 70 millivolts. But as the cell becomes sick, this potential starts to change. It actually, the further it deviates away from this negative 70 millivolts, the less oxygen and nutrients can enter the cell and the fewer waste products are excreted. So what does this mean? This means that toxins build up inside the cell and we have disease and dysfunction, which we don't want. So, neurotherapy is a really gentle injection technique that uses a medication called procaine. Procaine is the anesthetic. It's similar to Novocaine, like you get at the dentist office. Things I love about procaine, though, is it's metabolized in about 30 minutes, and it's actually converted into a type of B vitamin in our plasma by enzymes. So it doesn't put any additional burden on the liver to detoxify, which is great. And so procaine works by temporarily disrupting the resting cell membrane potential of the nerves that transmit pain signals. So if they were unable to transmit the pain, we would assume that the cell had an abnormal resting membrane potential. It would return to abnormal once the procaine wore off, right? So you inject with procaine, the procaine's there, it's kind of anesthetizing the cell, procaine wears off, the pain would be able to come back. Okay, that's what you'd think would happen. But what the Hunke brothers found, somehow, this isn't fully understood, research has found that the cell membrane potential of these abnormal cells, after the procaine wears off, it actually improves the cell membrane potential and it brings that number closer to negative 70 millivolts after the procaine has been injected. So we inject the procaine wears off, the cell membrane potential, which is previously abnormal, is now closer to normal. What does this mean? This means that the cells are now healthier. They can receive more oxygen and nutrients. They can excrete their metabolic waste products more freely, and this really promotes detoxification. So I want to go back just to the slide and just talk a little bit more about the interference fields. So like I said, I just want to point them out here. You'll hear some tonsils here, some scars here, and teeth here. These are 3 different types of interference fields. And these interference fields, basically they create chaos in our nervous system. This contributes to sympathetic overdrive or the increased sensation of being in fight, flight, or freeze. So, a lot of people who, in my practice, who don't respond well to a lot of treatments, maybe they're really sensitive to supplements, herbs, acupuncture. Once these interference fields are addressed, like once I treat their scars, they can actually respond a lot better to these treatments because treating the scars not only decreases being in this fight or flight, it decreases this chaos in the nervous system, it also helps break up fascial adhesions. So remember I said that abdominal scars are really important to treat. Say someone has something like laparoscopic surgery, or they have a gallbladder out or a C-section or something like that. When our skin heals and forms a scar, it doesn't just nicely layer on top of each other. So it kind of all crunches around each other and pulls on different fascia in the body. So what this means is if you have a scar on your belly, a lot of the times there's a lot of tension and things get all kind of stuck together. I had this one client actually when I was in my residency who had his gallbladder out. He was having a lot of shoulder pain. And when we treated his gallbladder scar, actually, it was allowing, you can't really see what I'm doing. Let me see if I can pull this down. Okay, so scar, it like twists on itself. If we treat the scar, we break up the adhesions, it allows this all to loosen so there's not this pulling on the fascia anymore. And this gentleman actually has shoulder blade pain, or his shoulder pain went away completely after treating a scar on his belly. It's really cool. And for those of you who don't know, fascia is a connective tissue. It wraps all around our organs and structures of the body. And when the adhesions form, because of scar tissue, it becomes really tight and short and it can't move and it's restricted. And these restrictions, can really spread to other parts of the body, creating further mechanical imbalances. Another thing that's really interesting is if any of you are struggling with back pain, you've had your appendix out, the way in which the appendectomy scar pulls in the abdominal muscles can actually put extra strain on our SI joint, sacroiliac joint. So if you have back pain and you've had your appendix out, or really any other kind of abdominal surgery, let me know because neurotherapy can help alleviate that. And as an added kind of beauty bonus, neurotherapy can also help heal the scars and can aesthetically lighten them, which is great. And neurotherapy is safe to do as long as it's been at least 6 weeks since surgery. Okay, so what else does neurotherapy do? I love using neurotherapy really to address lymphatic stagnation. So our tonsils, when waste products are excreted from the brain, they actually exit our brain through the lymphatic system, which feeds into our lymph, including the tonsils. If our tonsils become an interference field, if they get really backed up and dysregulated, waste products can then back up into the brain. What does this mean? This means we have fatigue, we have headaches, we have poor concentration, memory loss, difficulty with word recall. There we go. And even anxiety and depression. So if we treat the tonsils with little injections into them with Procaine, this actually allows for the tonsils to heal, the waste can leave, and people feel a lot more clearer and more sharp. And then, like I said, the teeth can also be a common source of interference fields. So in Chinese medicine, each tooth, disclaimer, I do not practice Chinese medicine. I know a little bit. Most of it is very confusing to me, but I think this tooth chart is really cool. So in Chinese medicine, each tooth sits on an acupuncture meridian. For example, the wisdom teeth are connected to the heart and small intestine. And so interference fields that develop on our wisdom teeth can actually, after the wisdom teeth are removed, can actually contribute to heart issues or digestive disorders. So if ever I have someone when their digestive symptoms aren't responding to probiotics, enzymes, avoidance of food intolerances, my normal things, supplements, herbs, all that kind of jazz, if they're not responding to anything, we always want to make sure that there isn't any kind of dental interference field going on. So sometimes I'll have them work with a biological dentist to get a 3D cone beam imaging of the mouth and jaw to see if there's any lingering infection there. So another way I love to use neurotherapy is through segmental therapy. And this is by doing tiny little injections called blebs over the organs of detoxification. So I inject little bits of procaine over the organ, and this means that the nerves that innervate that organ are able to better fire better. So there's increased nervous system communication with that organ. There's better facilitation of healthy blood and lymph circulation, and basically it allows that organ to be more nourished and do a better job of doing whatever that organ does. You can see on the left, this is someone's abdomen, and this is the liver pattern here. And then on the right, that is the kidney pattern, that's someone's back. Okay, so I wanted to talk about 2 interesting cases in neural therapy. Oh my God. So the first is with someone named Izzy, and Izzy was having a lot of chronic UTIs. About once a month she'd get a UTI, and we did segmental therapy over her bladder. And she noticed that she was actively having an infection, actively symptomatic during this, and she said it helped with her urinary frequency and urgency and burning while she had the infection. It also, when we did repeated treatments, stopped her UTIs from happening in the first place, which is amazing. Neural therapy can be really beneficial if someone is taking medication to treat an infection. For example, if someone's on antibiotics for a UTI, because it, like I said before, doing segmental therapy really helps improve the circulation to that organ. If that organ is better perfused by blood, that means basically the antibiotics and medication, or whatever the medication is better able to get to those tissues and help the body heal. Same thing with herbs. I prefer to use herbs than antibiotics, but in this case, this person was on antibiotics. Oh, and Izzy also says it's not very painful, and she'd recommend it for anyone with chronic issues. Okay. My favorite form of neural therapy is something called the crown of thorns. I do a modified version of this on myself quite often, and I don't love the name of it. I kind of want to rebrand it to something a little bit, better. So let me know if you have any suggestions. But basically what this is a series of tiny injections around the hat line on the head and also at the base of the skull. And the points at the base of the skull are actually called the Einstein points, and they help with really healthy circulation to the brain, promote lymphatic drainage. And people who do neural therapy will often inject themselves right back here before they give a presentation. I didn't do it before this, but sometimes before I'm doing longer webinars and things, I'll treat myself, and I just feel pretty clear and sharp and able to speak better, which is great. So the crown of thorns is wonderful for headaches, migraines, brain fog, difficulty concentrating, or anxiety. I had one client she basically felt like she was just constantly had a migraine, and she would come in for weekly sessions. We were actually able to have her pretty quickly. I was able to have her not have days without a migraine. So maybe after the first week, there was 1 day without a migraine, and then it came back. After the second week, she had 3 or 4 days without a migraine. We were eventually able to get ahead of the migraines. And, after her series, I think she came in for a series of 6 weeks, no longer having any migraines. Of course, we were also working on other underlying things as well. Migraines are interesting in that neural therapy can be really helpful in the moment when you have a migraine for decreasing the severity and the length of time. However, unfortunately, usually when people have migraines, they're unable to get in their car and drive to my office. So you can come in when you're having a migraine, amazing. You can have someone drive you. It's really, really helpful. So they're great for not only preventing migraines, but helping treat them when they're actively happening. And I always start with this when people are new to neural therapy. I love to start with crown of thorns because it feels really good. It kind of just takes the edge off the day. People feel a lot clearer, more sharp. I also always find I sleep better after this treatment as well. And so I want to talk to you about another client. This is Laura. She was writing her thesis. She was a graduate student in college, and she had a really difficult time with brain fog and fatigue, and was having a difficult time writing her thesis. And so she would come into my office, and we would do the crown of thorns. And she said this was the only thing that really helped her, kind of like her brain fog to lift. She could go back and write her thesis for the next few weeks. Then eventually the symptoms would come back a little bit. She'd come back in, we do another treatment. She also said, this is really cool, that it wasn't only helpful for her brain fog in the moment, but also helpful in treating her depression as well, which I love to hear. Okay, another cool thing I just want to talk about, because as the time I'm making this video, it's May and allergy season is in full force here in Portland, is something called the sinus rinse. So the sinus rinse, if you've ever done a neti pot, this is basically like the same sensation. If you don't like neti pots, this may not be your favorite thing, but it works really well for sinus congestion. Basically, the client will come in, they'll lay on my table, hang their head off the table, and I'll actually just squirt a little bit of procaine up both of their noses and the procaine up both their nostrils. And the procaine washes out the sinuses. So What does this mean? This means it like physically removes any kind of like congestion, like snot or any allergens that are present, but it also resets the nerves that are innervating the sinuses. So there's less inflammation. This one's great too, in that there's no needles involved. So this time of year, I'm doing sinus rinses pretty frequently. Okay, so risk and side effects. So allergy to procaine, the medication, is incredibly rare, virtually not heard of. If you've had Novocaine before, it's in the same family, you should be totally fine. So neural therapy, when it's performed properly by a trained physician, there's basically no risk or complications from the injections. Of course, as with any injection, you can always have bruising. I was trained to never inject a bride because it is a needle, you can't have bleeding. Infection from the injection sites is incredibly rare. I always clean the skin before. There may be a little bit of pain at the site of injection. Usually people say, oh, it's not that bad. I haven't had anyone like stop me from injecting. Sometimes they don't love it, especially over the ribs and the liver. That can be a little bit tender, but it's, the needles are really small. They're like similar to acupuncture needles. Usually people are like, oh, you know what? That's actually not that bad. Sometimes people even like how it feels, especially on the scalp. But one thing that can happen is, especially if I'm working with someone with a lot of environmental toxicities and we're treating the organs of detoxification, we can have a detox reaction. So when the interference fields are healed, there may be a release of toxins that have accumulated in that area. This can cause fatigue, headache, people can feel icky or hungover. And of course, we always want to mitigate these effects with adequate hydration, toxin binders, rest, and antioxidants. Lastly, a side effect, not a risk, is neural therapy, especially I find with the crown of thorns, can cause a temporary sense of euphoria. Afterwards, people usually feel lighter and more balanced. They can feel more relaxed, kind of like the weight's been taken off the day, and they can feel more clear-headed too. Unfortunately, it only lasts about 15 minutes, but it can be a really nice side effect. One of my bosses, when I was in my residency, called it the only high that's inherently healing, which is great. So how long does it last? Sometimes relief can occur immediately. This is called a lightning reaction. However, usually there's a partial improvement after the first treatment. The symptoms can return after a couple of days to a week. And then, we do another treatment. So, recovery is really a gradual process that involves other treatment modalities. Usually I find for people, it takes about 3 to 6 treatments to fully recover from chronic pain conditions. And, would the results last? I found that in time and after a proper course of treatment, the results of neurotherapy can actually be permanent, which is wonderful. It's really facilitating the body to heal itself. However, I use a lot of neurotherapy in my practice, but it is just one piece of the puzzle. I could go on and on and on about how amazing it is. It's one part of the wellness plan. So these are my 5 pillars of health: nourishment, detoxification, which neurotherapy plays a role here, gut health, movement and mindfulness, or M&M, and mentoring. So I put all these pieces together into a system. And now we have a system. 90% of failure, they say, is due to not having a system. So a lot of people who find my practice have tried other things. Usually I'm not the first stop. Maybe they've tried a few of these things, but maybe not all at the same time and not into a system that they can continue to use. Because this is a model that you can really do for the rest of your life, not just 6 months, 9 months, or a year. My goal for my clients is health independence for the rest of their life, and really for them to be their own healers. You're going to be doing the work. I'm just here to kind of show you the way and for some mentorship and accountability. Okay, so what's next? If you were already a program member and I sent you this video, I am super excited to see you for your upcoming session for some neurotherapy. And if you're watching this and you're a prospective client and you're curious about trying neurotherapy, or maybe you're curious about working together remotely through a wellness program, let's chat. So you can go ahead to my website, drkatbodden.com. I'll link it in the YouTube video here. It's also on my social media page. If you click the top right button, you can click book a free consult. And I would love to chat with you. So, at this free call, we'll really learn a little bit more about each other. It's really important to me to make sure that we're the right fit, that you're the right fit for my practice, and I'm the right fit to help you get you to your goals. Okay, so I hope you enjoyed learning about neural therapy and that you're excited to try it. And if you have any questions, please don't hesitate to reach out, and I look forward to speaking with you soon. Thank you. Have a beautiful day.